everybody for joining us. And as I said before we dive into today's presentation, I'm going to go over just a few housekeeping tips, is what I call them. You can feel free to ask any questions you may have throughout the presentation at any time by typing them into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your particular question, we will follow up with you personally via email after the webinar by tomorrow. And of course, we'll provide the contact information for both NeedyMeds and EyeCare America should you have a pressing question. So let's get started. For those of you that are not familiar with NeedyMeds, here's a snapshot of our homepage. And I always put that up because really our website is the face of our organization. NeedyMeds' mission is to educate and empower those seeking affordable health care. And we define that education portion of our mission really in two ways. The first way is by letting people know about NeedyMeds and the resources we have, and the other is by letting them know about other healthcare related resources, which is why we are so pleased to have our guest with us today. It's my pleasure to introduce our panelist, Betty Lucas. Betty has been the director of the American Academy of Ophthalmology EyeCare America program for 18 years. Prior to joining the Academy, Betty spent 20 years helping the underserved by running and designing volunteer programs for nonprofits, specifically in the Bay Area in California, and designing pro bono law clinics in Alameda County. We are honored to have Betty provide an overview of how EyeCare America works to protect sight and empower lives, and walk us through the resources available to you and your loved ones. So without further ado, I'm going to go ahead and pass the mic and the screen to our host, Betty. And Betty, you're ready to take it away and begin the presentation. Thanks, everybody. Enjoy.
Thanks, Carla. Let me just see if I can do this. Yes, thank you all for coming. EyeCare America is a public service program that's been serving the underserved older Americans through volunteer ophthalmologists for more than 30 years. We operate two programs. One is our flagship program that's really more than 30 years old. It's our seniors program, and it's designed for medically underserved seniors 65 and older. And about in 2010, we really felt like we were missing a lot of people, and our whole purpose for being is to preserve sight. So we started a glaucoma program designed for people who are at increased risk for glaucoma, determined by their age, race, and family glaucoma history. We have more than 5,500 dedicated volunteer ophthalmologists all throughout the U.S. ready to see EyeCare America patients. And a couple of milestones is our program is unique, and you'll find out more about how we operate, but we are one of the largest public service programs in American medicine today. And we've helped nearly 2 million people. I think in the next year we'll pass that number since our inception in 1985. And the most important part, and what is unique about our program, is that more than 90% of the care provided is at no out-of-pocket cost. And there have been studies done all over, all the time, about what keeps people from, seeing a doctor. And number one is cost, and the other is distance. And we kind of address both of those barriers to care. A little background on some recognition. As you can see here in the photograph, this is our founder, Dr. Hutchinson, shaking the hands of President Reagan. He helped us launch our program back in 1985, and we were introduced to Congress. We've been publicized through AARP, NCO, National Council on Aging, National Eye Institute. Every senior center has our material. We are listed frequently in national public magazines and periodicals. We were just mentioned in Women's World. Dear Abby mentioned us a few months ago. USA Today, Dr. Oz, New York Times. We're often in the news. We've been recognized by the Senate and House for our 25 years of service, and every president since Reagan. Let's see here. Why is this? There we go. Now, our seniors program, you have to be 65 and older, a U.S. citizen or legal resident, and have not had a medical eye exam by an ophthalmologist in 3 or more years. And our criteria is set because of a waiver that we have from the federal government, and they consider 3 years people being out of the medical system. They're not taking care of their eyes if it's been more than 3 years. So we don't want to refer people to a doctor they already have. We want to catch people who don't have an ophthalmologist or haven't seen one in 3 or more years. The U.S. citizen and legal resident is because the federal government requires that it be U.S. citizens or legal residents. We know there's lots more people out there that need and deserve the help, but we have criteria that we have to stick to. And the age 65 or older is because of our waiver that I'll explain in a minute. It is what makes us unique. And the reason that you can't belong to an HMO, a health maintenance organization, or have EyeCare through the Veterans Administration is, number one, you could already get this care through your HMO. If you have a condition of your eyes, you can get EyeCare. You can't get the regular just checkup, but you can get an eye exam through an HMO and the Veterans EyeCare insurance. And also the other reason is that we match patients and volunteers by the zip code of the patient and the doctor. And it is done on a rotating basis, and it's done by the computer, and we can never know if that doctor is going to be a part of that HMO. It's restricted to only being able to see certain doctors. And so what do people get? They get, for the seniors, they receive a comprehensive eye exam and care for up to 1 year at no out-of-pocket cost for any condition diagnosed in that initial exam. So if nothing is diagnosed, they have the exam, and it's at no out-of-pocket cost for them. Volunteer ophthalmologists will bill Medicare if that person has Medicare. About 17% of the seniors we serve don't have Medicare at all, and they'll be seen for up to 1 year at no charge for anything. But if they have Medicare, they will be billed. Medicare will be billed, but it will be at no out-of-pocket cost for that patient. So that 20% that often keeps somebody from going to see a doctor is they're cash poor. They might be house rich, car rich, but they're cash poor, or they have to divide their income, their extra cash, between prescriptions and paying PG&E. So this special waiver that I referred to is an Office of Inspector General advisory opinion that it permits our only EyeCare America volunteers to legally waive Medicare copayments and the unmet deductibles for EyeCare America patients who are 65 and older. And so this is a Medicare waiver that we're the only waiver in the United States except for one that I know of, and that's called an organization called Copay Relief for people with cancer and chronic high copays. And we also then started our glaucoma program in 2010, and we kept with similar criteria, U.S. citizens or legal residents, but in this case, they cannot have had an eye exam in 12 months or more rather than 3 years. And we're not, because this is for people who are under 65, we don't have to follow the Medicare federal government's guidelines of 3 years, because we just want to get somebody caught early enough to treat them. They are determined to be at increased risk by their answers to our questions of their age, race, and family history. Those will determine if you have somebody that has glaucoma in your family, a mother, father, brother, sister, it has to be immediate family member. You're at increased risk for glaucoma, and you might not know it. And this whole program was started because we still wanted to catch more people and stop the progression of blindness at least earlier. Dr. Hutchinson, our founder, 35 years ago, got tired of seeing so many, as an ophthalmologist practicing in Boston, he got tired of seeing so many seniors, 65 and older, so late that he couldn't stop the progression of blindness. And this is why we exist. So for the glaucoma program, patients receive the glaucoma examination, and if they are uninsured, this exam is at no charge. If they are insured, we are not under the waiver for this program, so we can't waive co-payments of Medicare or unmet deductibles, so a patient will be billed. But no matter what, this patient is at increased risk and might not have known it. Glaucoma is a condition, a disease of the eye that affects the optic nerve, and you can't feel it often. There are no early warning signs. It's like a rope that's fraying and fraying. That's your optic nerve. And if it, sometimes you can just notice a little difference in your eyes and then go to see the doctor. And by that time, it could be too late to stop the progression. This is near and dear to my heart because my mother prided herself, she was in her mid-60s and she never goes to the doctor. She only went to the doctor to have babies and that was it. And one day she saw something different in her eyes. Her field of vision was immediately shortened, and she went to the doctors to see an ophthalmologist, and they could not treat her. Her glaucoma was already progressed too far, and she ended up going completely blind. So it is this program, we get surveys back from patients, and our glaucoma program is one of the most powerful for the appreciation of people finding out that they never knew they were at increased risk. Now they know, and they can have their eye exams more regularly. So how do we find these patients, or they find us? They go online to our EyeCare America website, and we have a question, see if you qualify. And they'll answer all the questions that we need to figure out whether they're eligible. And the computer does this all on it's all programmed. And eligible patients receive a letter with the name of the nearest volunteer to them on a rotating basis. So if one volunteer has received a referral, the next and the next, it will rotate around. And that patient is asked to bring the letter to be seen, and then the volunteers receive a letter saying this patient is going to call. And then at the end, they send us an outcome form saying they saw the patient and what they diagnosed. Now, we never match the name of the patient with the diagnosis for HIPAA compliance, but we can tell you that since our inception for diagnosis of cataract, we have diagnosed nearly 100,000 people with cataract, AMD suspects, more than 15,000, and the numbers just keep on going. And now you might wonder, why would we have a service for underserved seniors and have it online only? We wondered in 2010, when we did move from a call center to online, if that was going to be a difficult situation. And what we found is that anyone without a computer knows somebody with a computer somewhere. It could be a child, it could be a social worker, and all these people we work with. We are on, we send information to social workers and health professionals all throughout the U.S. to let them know that they can see if their clients are eligible. Within a minute, they can find out by answering those questions with that person in the same room, or at least accessible to answer the questions, when was their last eye exam, and the rest of their medical information. Family members can see if their grandmother or their mother is eligible at our referral application form, and that's on our URL is aao.org/EyeCare one word, EyeCare America. But you could just type in EyeCare America and you will find us. We also work very closely with partners that have national organizations that serve the people that might be eligible for us, so older Americans. We offer free brochures, risk factor cards. So a glaucoma risk factor card can tell you whether or not you are at increased risk by answering 3 questions. What's your age, race, and family history? This is one of our most popular cards for organizations to distribute to their clients, senior centers, and we have flyers. We have an age-related macular degeneration risk factor card, which has a Snellen chart on the back where people can literally look at a chart and see if the lines look wavy, they need to get an eye exam. So these are things that are free for any organization, individual, or group that works with seniors or older people or wants the information. And if you want a packet of information, anyone on this call or any partner that we have, by the way, we have, I looked it up before this call, we have a total of 3,878 partners who order material from us on a regular basis, and that increases every single year. So you can email us at EyeCareAmerica@aao.org. In addition to the material we offer online, we have a resources page that includes discount eyeglass resources, medication assistance information, and that's linked to NeedyMeds that Carla will tell you more about. We also have a discount drug card, and it is from NeedyMeds, but it's got EyeCare America on it, and we have actually helped people save nearly $60,000 in the last 2 years just using this discount card. And it is you can get up to 80% discount on any prescription that you have that isn't covered by your insurance. And you can go to any drugstore and just show the card and they'll tell you how much you get off. If you get none off, then you just pay what you pay, but many people are being helped by this. And every single day we receive surveys from every patient we refer, we send a survey to, so we get surveys regularly. This is just one of many. Thank you for taking a big one off my worry about list. Her Social Security money wouldn't stretch, and this is something we hear a lot. I just looked up this week's little cards that we get back from people. Sometimes it's cards, it's emails, it's surveys. I can now see, I'm a retired RN and now enjoy every day with new sight. This is a person who used to refer her clients to us. She lost her job and she needed care, and she was able to get care. This is another person who said, if not for this program, I wouldn't have known I have cataract in both eyes. Because of EyeCare America, my cataracts have been removed. That person was in North Carolina. The first person was in California. This one from Kansas. I haven't been able to afford an eye exam in 10 years since Medicare. So you can tell it's a variety of people that we're able to help, and we hope that this information helps you help your clients or your family members or even you. And please feel free to email EyeCareAmerica@aao.org. And I'm happy to answer any questions you may have. Thanks for your time.
Betty, thank you so much, as always, for taking time to share your expertise and the really crucially important, really life-changing resources that EyeCare America provides to a population that otherwise would be vulnerable when it comes to taking care of your eye health. And I appreciate your sharing this story, your own personal story with your mom about how really what could happen if somebody doesn't have immediate access to the care that they need. If you're able, I'll ask you, Betty, to go ahead and change the, let me grab that screen back from you. In the meantime, while we're doing that, thanks so much. When we're doing that, I will remind our audience, I do see a couple of questions coming in, but don't hesitate to submit questions. And again, you could do that by typing them into the questions section of your GoToWebinar control panel. Don't worry, though, if you're anything like me and those questions pop into your mind about 10 minutes after the webinar has ended. As I said, we'll give you Betty's contact information as well as the contact information for EyeCare America and NeedyMeds. Before we present the questions to Betty, who did graciously mention NeedyMeds and our drug discount card, I do want to remind everybody listening, I'm not going to take tons of your time to get into all of the resources that NeedyMeds has. Just remember that we are here to connect people free and anonymously to programs that will help them save or afford their healthcare expenses. And that includes, but is not limited to, medications. And here's a couple of ways that we do that. We have a robust database of prescription assistance programs that will help you with those name brand medications. We also have something called our $4 generic discount drug program. That's not on the list there. I should have added that. That helps with the cost of those generic meds. We also have a database where you can search for assistance for your just for your diagnosis. So you don't have to type in a medication name. You can just type in the name of your diagnosis, such as glaucoma, and see if there's a diagnosis-based assistance program available. We also have a database of coupons and rebates. And as Betty mentioned, we do offer a drug discount card. If you're interested in learning more about the resources we have, and that's just really a very brief list. To give you the heads up, we have more than a dozen categories of cost savings resources on our website and more than 20,000 points of cost savings. So you can see why I'm not going to take the time to dive into those now. I just want to stress that NeedyMeds is a resource that hopefully you'll rely on, and I encourage you to visit our website, needymeds.org, when you get a chance, and certainly attend one of our monthly overview webinars, and you can find those on the bottom right hand of our homepage. With that, I also want to, I talked about joining us for an overview. We do have one coming up on April 9th if you want to learn more about NeedyMeds. And we do, in April, have a couple of other upcoming webinars. So check those out to see if there's any topics you're interested in. And while I pass the questions along to our host, Betty, I'm going to go ahead and leave up my contact information, Betty's contact information, and of course the toll-free helpline for NeedyMeds. So Betty, one of the questions that is coming in is, do recent healthcare changes affect EyeCare America?
That's a really good question, and I can tell you that no matter insured or uninsured, there are always copays for people who are 65 and older, and those copays are what keeps people from being seen by an ophthalmologist. So we think that, and also a lot more people are uninsured now with some of the health changes, so we're probably more important right now than we were a couple of years ago. Yeah.
I think that, thank you for making that so clear. And as everybody's listening, you can see why we keep asking Betty to come back, because there's always a concise, straightforward answer that lay people like myself and some members of our audience, we can understand. It's a straightforward, clear answer to things, and also and you'll find that with EyeCare America. Here's another question coming in, Betty, and I think you get this pretty regularly. If you're aware of a program or resource that's available for adults to obtain a free eye exam and or prescription eyeglasses.
Very good question again. Yes, eyeglasses is, I think, the big black hole in the world. And a lot of people think they need glasses when in fact a medical eye doctor could detect a condition such as cataract. Many people think that they need glasses when things are blurry or hazy, and it turns out that they have cataract. But for people who do need glasses, there are a couple of programs out there. First of all, I tell people to check your local Lions Club, because sometimes they do have services in different cities and states. And we also partner with Lions, and Prevent Blindness offers an assistance program for eyeglasses for people who fall into the federal poverty guidelines, 200% of the federal poverty guidelines. And I can tell you that almost everyone who calls us is under the federal poverty guidelines. So we do refer to a couple of other organizations. And then there is online, there's something called America's Best. That's not free, but it does provide the refractive exam. So you get your prescription and 2 pair of glasses for $69. And they're not everywhere, but they're all over the US, and you can just type in your zip code and see. That has helped some people. And then you do have to have the prescription already. So I would say there's the Sam's Clubs and the Costco's of the world that do have discount refractive exams for people to get their glasses, their prescriptions. But it is a big black hole, and it's something that I think that eventually there are going to be refractions online for people. There already is one that you can go online and refract yourself, but you have to be under 40, and I can't remember the name of it, but you can just search for it. There will be more and more capabilities as technology, improves. Eventually, I think we'll all be able to refract ourselves on our cell phones and then send it into whatever prescription we're going to buy. And for eyeglasses, we can already online. If you do have your prescription, you can get a lot online. So A long answer is there's not much out there, but there are discounted, and you have to do some research and kind of look around, but they do exist.
They do exist, and I think the point you made about the direction in which vision care is going regarding mobile apps and simply submitting your prescription online to get your customized glasses. As you said, there's already technology available to do that. So we're definitely headed in that direction. And it is a question that I've heard people ask Betty before. So thank you to the audience member who brought that up. One of the things I would also like to say is at NeedyMeds, as I said, our goal is to connect people to programs that will help them afford their healthcare expenses. And that's not limited to medications. So on our website, I would recommend checking under our Diagnosis-Based Assistance Program database. That's under the Patient Savings tab. And you can check for a category such as eye care or vision. But what's even easier is please reach out to our expert call centers at that toll-free helpline, which is 1-800-503-6897. They're here to help. You don't have to become an expert in the NeedyMeds website to try and find a program that will help you afford your eye care needs. Let our expert call center counselors do that work for you. And what I would recommend is Betty is an expert. She knows that there's not tons of these programs available out there. Certainly, if you're aware of one that we're not, please let us know. But I'm stressing that because as Betty had so rightfully said, things are changing. Other resources will become available. This is certainly a big black hole in the healthcare industry, but things are changing. And the reason I'm stressing that is because if you call NeedyMeds today at that toll-free helpline and we don't have a program now, call us back in a couple of months or a few months. It should only take a minute or a couple of minutes out of your day to do that, because programs change all the time and new ones are added all the time. Just because we don't have one today doesn't mean we won't have one in the fall. Betty also mentioned that some of these programs may have, you may have to know where you fall in the federal poverty guidelines. If you need help with figuring that out, again, you could call our expert call center counselors. They can figure that out for you over the phone, or they can point you to our federal poverty level online calculator, and you could figure it out for yourself. And actually, I have one other question coming in, and I think it's a great way to wrap up today's presentation, which is, how does an individual get free materials about EyeCare America, and how does someone go about getting pamphlets or brochures for their place of work or office?
Well, we send this out all the time, so we encourage you to email us at EyeCare America, that's EYE America at aao.org, and just request a partner packet. We'll send that with samples and then an order form that you can order as many as you want while supplies last. And then you can order when you run out as well. We check back with our partners to see if they have run out, but it's really easy to do. And even if you're just an individual and you want samples, you can get them from us. Just email us.
Yeah, and as you can see, Betty and the team at EyeCare America make it as simple as possible, and I will mirror that as well, sort of piggybacking on everything that Betty says, but NeedyMeds is happy to do the same. If you're interested in learning more about NeedyMeds, getting educational brochures, drug discount cards, that can have the EyeCare America name and logo on it, let us know, and you can drop me an email. My email is on that PowerPoint slide, carla@needymeds.org, or again, you could reach out to our toll-free helpline. A reminder that the PowerPoint presentations for today's webinar are in the handout section of your GoToWebinar control panel. If you find you have trouble downloading them, please don't hesitate to shoot me an email, and I'd be happy to get those to you. Also a reminder that this webinar is recorded, and we will convert it into a video to be posted on the NeedyMeds YouTube channel. And that's a great resource that I hope you check out and peruse some other special topic webinars that might be of interest to you, your colleagues, your family members, or your loved ones. So with that, thanks so much, everybody, for taking time to learn about this really great resource, EyeCare America. And thank you, Betty, for sharing your expertise with the NeedyMeds audience. Have a wonderful rest of the day, everybody. Thank you.
Thanks. Bye.